Welcome to today's webinar presented by SuperCoder.com. SuperCoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Some things up in terms of how you're doing things at this time. I hope you've had a chance to also print out today's PowerPoint handouts, and we're going to move on to slide 2. So as I said, the time is ripe for case management. And with all the healthcare reform changes that we're all aware of now and everything that's going on, it really is a very good time to step back and take a look at your structure and how your work is organized. The processes are accelerating. It's really very hard sometimes to keep up with all that's happening through CMS, Centers for Medicare and Medicaid Services, and all the additional core measures and other indicators that we're being held to. Of course, we've been looking at readmissions for a while, but now we're adding mortality measures in the outcome section of the CMS measures, and there'll be others coming as well. So many changes. And then all the audits, the RACs, the MACs, and all the others, really looking at the Medicare population like they've never really looked at before, really requires us to think more deeply about how we gatekeep patients entering our health systems. Nobody's got extra money these days, and so when we sit and look at a case management department, we try to figure out how to re-engineer that department with the positions you currently have in as budget neutral a mechanism as possible. But sometimes many of our departments are simply understaffed. So if you're listening today to see what the right staffing ratios are, we will absolutely get into that today as well. I mentioned the Affordable Care Act and value-based purchasing really have really moved case management to the forefront, and we're no longer sort of that add-on department, but we have become a very important key player in our healthcare organizations. And finally, how do we address the need to really promote a stronger care transitions approach? How do we integrate between the hospital, the community, home care, the physician in the community, the subacute setting, and so forth? And that really presents a continuing challenge for so many of us, figuring out how to do that. And again, it comes back to many times how our department is structured. So moving to the next slide 3, let's think about in our minds what a model of care really is. It's really not anything we can see. It's a description. It's an exemplar. It's an ideal. It's how we want our department to be organized. And I think the best way to think about it will be through some of the visuals we're going to see in the next few slides. And it really takes a moment to sit back and say, who's doing what? How do they do it? Are they doing too many things? Are they the right people to do those things? And that really gets down to how that model looks. So on slide 4, think about your case management model. Obviously, that's mainly what we're talking about today. But we also have to think about how your case management model relates to the other care delivery models and the other folks that you're working with. So you have the medical model, and we'll go into what we mean by that, and then you have the nursing model. Of course, in addition, there are ancillary services that feed into all 3 of these, but today we're going to talk about these 3 because these are 3 principal models that interrelate to each other in terms of direct care. So let's talk a bit about the medical model in particular. And so many of us have such a variety of ways in which our physicians are organized in terms of their work. Probably a lot of you listening today have hospitalists. And hospitalists came on the scene a number of years ago, and these are usually employed physicians employed by the hospital who really, in theory, should be aligned with the case management staff, having the same goals and expectations. unlike a private physician who, particularly on a medical floor, who is financially incentivized to keep.
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.